Hi, and welcome to Conversations with B'nai B'rith International. I'm CEO Dan Mariaschin. Thanks for spending some time with us today. If you enjoy our conversation series, make sure you never miss an interview by subscribing to the B'nai B'rith YouTube channel and by liking us on Facebook. And of course, be sure to visit our website, bnaibrith.org, to learn more about our humanitarian and advocacy efforts around the globe. America is aging. The number of Americans 65 and older will more than double over the next 40 years. And as the number of seniors increases every year, so will the need for affordable, aging-ready housing. That's why Dr. Jennifer Molinsky wants to deepen our understanding of the implications of aging populations and how we as a nation can tackle some of the critical housing challenges that lie ahead. Dr. Molinsky is project director of the Housing and Aging Society program at the Harvard Joint Center for Housing Studies. As project director, she leads research exploring these issues facing the aging population, including affordability, accessibility, and safety in the home, community livability, and connections between housing, services, and health. Today, Dr. Molinsky and I will discuss the importance of suitable and affordable housing for America's older adults, the role of housing in well-being and health in older age, and more. Prior to joining the center, Dr. Molinsky was chief planner for long-range planning in Newton, Massachusetts, and held positions with the Lincoln Institute of Land Policy, Municipal Arts Society of New York, and PwC's Government Housing Finance Practice. B'nai B'rith is the largest national Jewish sponsor of non-sectarian federally subsidized housing for older adults in the United States, with 38 buildings and 28 communities providing affordable housing for more than 5,000 people. Working in partnership with the Department of Housing and Urban Development, HUD, B'nai B'rith makes rental apartments available for senior citizens with limited incomes. We pride ourselves on our unparalleled expertise and leadership in protecting seniors and advocating on aging issues, which we'll be covering today. Dr. Molinsky, we're delighted to have you with us.
Thank you. I'm so happy to be here.
Well, let's jump right into it. According to the report, Housing America's Older Adults, published by your office in 2019, only a third of older adults who qualify for rental assistance have actually received help since 2015. And as I mentioned in my introduction, the number of seniors in the U.S. is increasing every year. According to researchers, the population of older Americans will nearly double by 2050. So how will the current state of affordable housing and the trajectory of the senior population in this country impact the need for affordable housing by older Americans in the next decade and beyond?
I think we're at a concerning point in that regard. As you say, the number of older adults is set to double. The number of adults 80 and over is set to double. In fact, that's the fastest growing age group in the whole country. And by 2035 or so, we expect that a third of households will be headed by someone 65 or over. So this is really an unprecedented time. It's an unprecedented growth in the older population. And we do know that at age 80 and over, especially, we have more need for accessible housing, services in the home, but also affordable housing. And so right now, serving only a third of those who qualify, because housing is not an entitlement program, we already have a massive unmet need. And yet trends towards population growth, widening income inequality, just suggest that we'll have more and more need for those programs that already don't reach enough people.
Older age brings particular considerations, including related to housing costs, accessibility, neighborhood livability, and more. So my question is this: what are your research priorities for the Housing and Aging Society program, and how will you also be looking at inequities, particularly in things like services that help other people thrive?
Our priorities right now are fivefold. We have affordability, accessibility, services in the home, because for many people wanting to age in place, it's not just the shelter of the home, but it's all the services that you need within it. It's livability within the community, so that stepping outside your door, you have access to transportation and the services that you need. And it's housing options, because we want to be forward-looking and think about solutions, not just about these challenges that we have. So, what kinds of housing options do we need to support older adults who live in a variety of settings? So, the housing needs of a person who lives as a single older person versus in a multi-generational household, those are very different. So, we want to be mindful of that and try to think about the solutions for all of those different populations. We know that there are deep inequities in our society and that they compound over a lifetime, so that by the time people are in older age, we do have some really deep disparities in access to home ownership and home equity, in wealth, in access to services. And so for us, that is really the focus of our work. It's on the lower and the middle income households that really can't afford assisted living or are other options that they might wish to live in. And so that's really where we want to emphasize our work.
Well, I mentioned at the top of the program, Enabra sponsors HUD senior housing properties across the country. As you know, we work with our management professionals on a variety of issues and hear from them about the challenges that residents face. And we know that many of our buildings have food pantries, which residents can rely upon for nutrition. Many of our residents qualify for SNAP and Medicaid, but even with that targeted assistance, a large percentage of our residents find it difficult to afford groceries and medications. Building staff work hard to find solutions, for example, partnering with local food banks or other nonprofits. In your experience, what happens when seniors are cost burdened with housing, and what do they give up? That is, what are the trade-offs and what are the consequences for that?
Yes. So about a third of older households are cost burdened, which in our definition is paying more than 30% of income on housing costs. About half of those pay more than 50% of their income on housing costs. So this is obviously a very significant thing. Cost burdens are much more prevalent among renters, among households of color, and among those who are older. So when you think about dividing 65 plus, it's the 80 plus who are more likely to be cost burdened. We know that people with very low incomes who are affordably housed versus cost burdened have dramatically different expenditures on food and on medications, out-of-pocket medications. So we know that the typical severely burdened household that's 65 or over spends only about $195 per month on food, compared to those who are affordably housed spending $368 per month. And the same is true. The differences are just as stark with those who are in terms of their out-of-pocket healthcare costs. So we know that when people face housing cost burdens and struggle paying housing costs, they often maybe give up a prescription. They don't take it as regularly. They don't visit the doctor if it has a copay. So even though there's Medicare in older age, these, the costs, out-of-pocket costs still accumulate quite a lot. So there's a really direct line between affordable housing and health. And we want to make that more and more clear.
As the Benebra Center for Senior Services, we're keenly aware of the critical role affordable housing in a service-enriched environment plays in the lives of older Americans. It particularly impacts their ability to age in place and avoid a premature move to a more costly institutional setting. So how does affordable housing work in tandem with services and supports like a service coordinator? And how does HUD Section 202, the Senior Housing Program, help seniors age in place?
Great question. So the service coordinators are an amazing group of professionals who support older adults and others living in subsidized housing. Generally, they help connect people to benefits. They help connect them to food or medication. We did a couple of surveys during the pandemic of service coordinators, and really were so impressed by the work that they were doing to support older adults. And they really had to pivot to support older adults because suddenly people couldn't go out and get food. So they coordinated food deliveries. They partnered with groups across their communities to get food deliveries. They helped people access new benefits that they were suddenly eligible for. They helped people connect with family. They helped people get online for the first time, which, and visit their doctor through telehealth. So service coordination is an incredibly important aspect of housing, and to have those services delivered right where people live is a huge benefit. And in fact, I think one of the interesting things for us as researchers is how can we learn from what's happening in subsidized housing with service coordinators and think about lessons that we could apply more broadly to people living in all sorts of settings. So really, really important. And Section 202, of course, has traditionally supported service coordinators in their buildings and really help people not just have the physical shelter and the affordable housing, but have all those things that they need to age in their particular preferred place.
Let me stop here for a moment. And because I mentioned HUD Section 202, Senior Housing Program, we have been a leader in advocacy for funding affordable housing. Why do you think in our society, which we have a lot of things on our plate, but everybody ages, everybody gets old, everybody has parents, grandparents, and it's not something which is hidden somewhere, it's right out there. Why is it that this issue does not get more favorable attention and action than it does?
I wish I knew the answer to that, but I think it's a combination of discomfort with aging. So I do think there's that. I think there are a lot of assumptions about older adults that, most older adults, the homeownership rate is the highest among older adults of any group in the country. So I think there's this assumption that people have, older adults are wealthier. They have a lot of equity built up in their homes and they can tap that. But that's simply not true. First of all, there's many, many people who are not homeowners. And there are many, many people who have very limited equity in their homes if they do own them. So I think it's a combination of misconceptions and a desire to look the other way about the aging question, and perhaps thinking that this is really, a family responsibility. It's not a public responsibility. But unfortunately, I think the need is just too great to put that onto families. So yeah, I think it's a combination of all those things.
Well, we're working to change that impression,
yes.
change that perception, and change that image. Well, equally important to the points that we've just discussed are accessibility features inside seniors' homes and their proximity to transportation, to shopping, to healthcare.
Yes.
Talk about the challenges that seniors face, either adapting their homes as they age or finding housing that has features and accessories that meet their unique needs. And additionally, how do walkability and transportation factor into housing and accessibility?
Right. So we'll start with the home. Accessibility in the home really can be the difference between being enabled to age in place versus, having a disability that prevents you from remaining in your home. And we know that less than 4% of housing in the United States has basic accessibility features. And the ones that we have pulled out to look at are a no-step entry into the home, a single floor living opportunity. You don't have to live on the single floor, but you could if you had to. And extra wide hallways and doorways so that you could navigate with assistance, with a walker, with a wheelchair. So less than 4% of the nation's housing has those features. And modifying, can be as simple as adding in a grab bar, although sometimes that's not as simple, to adding an addition to a home. So there's a whole range of need that we have to help people modify their homes. And there are programs out there. They may not be well known, but there are some programs that can help people address these needs. Once you step outside the home, and again, accessibility is important so that people can do that. I mean, one of the things that we heard during the pandemic was the importance of adding accessibility features on the front porch or the front steps so that someone could go out of their house to pick up the groceries that someone delivered for them. So it's no small thing to say that an accessible house lets you, participate in community life. But once you're outside the home, of course, having transportation alternatives, having walkable sidewalks that aren't broken, and having, destinations in your neighborhood. Those are all features of livability that we talk about. We know that people give up driving as they age, and we know that many, many older people, especially the baby boomer generation, are aging in low density suburbs where their transportation alternatives are not many. So these are really important issues.
Given that the population of older Americans 65 and up is growing rapidly, and from the trends that you're seeing, what can the government do on the federal, state, and local levels to increase the supply of affordable housing with services? And what additional programs and resources are required to overcome this barrier?
Mm. Well, fortunately or unfortunately, there's something for everyone in this question. There's something that every level of government can be doing. So at the local level, we have quite often barriers to building more housing. So in the form of zoning, typically. So rethinking that, and a lot of communities are doing that. My own community is thinking about that. How can we add more housing options to, especially in a suburb, to the single family home, whether it's apartments, condominiums, accessory dwelling units, what have you, that allow someone to remain in their community, but maybe not in a home that has become unsuitable. So this is a challenge, I think, for many, many communities to sort of rethink what housing options they might have. I think a lot of the livability aspects are also local. The complete streets, the walkability, all that stuff comes at the local level. At the state and federal level, we have, I think we can think more about greater funding for programs like 202. That's a federal issue. Some states have their own programs. Massachusetts does. So thinking about more subsidies for affordable housing. We are, as I said, serving a third of the older adults who are eligible. We need to increase that even as those numbers are increasing. So that's a significant role. And then lastly, I would say we are doing a decent job of this, but need to sort of take the next step, and that's marrying health and housing. So our health agencies, our health programs, our health insurance programs, Medicare, Medicaid, and our housing programs, they're not always compatible. Your eligibility for one is different from your eligibility from another. It makes things very complicated for housing providers like B'nai B'rith to figure out how to get both the services and the housing. And so I think we could do a better job at all levels of government, sort of really being more consistent and collaborative across these different domains.
Statistics indicate that the number of homeless seniors is rising, which has a direct impact on the healthcare they receive. We're just talking about healthcare. For example, according to the University of Southern California initiative to eliminate homelessness and the Los Angeles Homeless Services Authority, less than 10% of unsheltered adults 65 and older reported having Medicare in Los Angeles County in 2017, even though Medicare covers almost all seniors. So it seems that the earlier seniors enroll in Medicare, the easier and cheaper it would be to treat medical problems. How does this lack of permanent housing impact this population's health care? And would increasing affordable housing ease the burden on Medicare?
Yes, we're worried about this. The numbers and the trends with older adult homelessness are definitely becoming more and more dire. And we do know that someone who is living on the streets has health issues that are that appear earlier in life. And so some of the estimates are 10 to 20 years. A 50-year-old who is experiencing homelessness has the health problems often of a 70-year-old. So this is really, for both sides, for the housing and the health, it just makes enormous sense to address these issues. We're also concerned that the younger of the baby boomers, so those born 1955 to 1964, have traditionally had higher rates of homelessness because they've experienced more economic disruptions in their life than their older baby boomer peers. They have been sort of competing for jobs and coming of age in recessions and all the things that don't bode well for building income and wealth and having that security and stability. So there's lots of reasons to worry, but we do know that providing housing is good on all these fronts. The economic argument is there, the health argument is there, and hopefully the moral argument is there too. It's just, the right thing that we need to be doing.
Okay, one final question. We're now entering the third year of the pandemic. And of course, during that first year and a half, the pandemic hit seniors so hard. Is there anything that we've learned during this period in terms of its impact on seniors that helps us in planning for all of this affordability in housing and services that we've just talked about?
I think two things, two broad categories. One, I do think we're going to see more need. The pandemic's long-term effects, we're still trying to figure those out. Long COVID, all of that, the need to continue to shelter periodically. So I think that the need for affordable, stable, healthy housing is going to be greater than ever, even than we would have predicted before the pandemic, just given the population changes. I do think that the pandemic really shined a very bright light on the importance of housing with services, the services delivered to the home. Early in the pandemic, I remember getting some phone calls from members of the press wanting me to talk about the future of senior housing, and that senior housing was somehow over because of the terrible experiences that occurred in nursing homes, that no one would want to live in a congregate kind of setting, even if in your own apartment in a building with other people. But I think that organizations like yours and many others across the country have really shown that having service coordination on site, having people to look out for their older residents, to make sure that they were getting food and medication and anything that they need, and socializing, even while socially distant, has really highlighted the importance of that kind of housing. And so I hope that that's a lesson we take forward. And I guess the other thing I would say is that all of us had an experience of social isolation like never before. And social isolation and loneliness are things that older adults experience and have experienced, to a greater extent, even before the pandemic. And so I am hopeful that we have a little more empathy around these issues, and that we really raise up isolation and loneliness as really critical issues that deserve to be addressed, and that there is a housing, there's lots of dimensions to them, but there's a housing dimension to that, about where you live and how you can access opportunities to engage with other people.
The new Housing and Aging Society program at Harvard's Joint Center for Housing Studies is doing tremendous work exploring the implications of aging and finding solutions to America's housing needs in the decades to come. You can find all of their analyses at jchs.harvard.edu. Jennifer, thank you so much for being with us today and sharing so many valuable insights. It's been a pleasure speaking with you.
Thank you so much, Dan. It's a pleasure to be here.
Well, our thanks to Dr. Jennifer Molinsky for sharing her expertise on housing and aging in the United States. And thank you for tuning into this conversation with B'nai B'rith. If you enjoyed this interview, make sure you catch all of our programs by subscribing to the B'nai B'rith YouTube channel and liking us on Facebook. And be sure to visit our website, b'naibrith.org, to learn more about our important work, including our efforts supporting Ukrainian refugees, as well as those still within Ukraine's borders. For my guest, Dr. Jennifer Molinsky, and for B'nai B'rith, I'm Dan Mariaschin. Join us again soon.